All right, if you're just joining, you're welcome. So tonight we'll look at two important themes. We will start with morning sickness. We'll look at the whole story in details about morning sickness. 9 people in the viewers are in the FYP. I see you. You want to jump in? Let's tap and take the likes of 10K likes. Right, so we'll look at morning sickness first. Then we will look at some details about azoospermia. And it's important if you know a man, a couple, somebody who needs that information, you want to call them on the phone, let them join this live stream because we're going to break it down and look at all the details about azoospermia. Does azoospermia means zero hope, no future hope? We're going to look at all those things and see how to help you with information that will rekindle your hopes, right? So, morning sickness and azoospermia is what we're going to handle today. So please, this is the time to share the live. This is the time to call those who you think, the brother, the sister, the neighbor, family member who need some clarity on fertility. This is the time. Let them come. Come and learn something tonight. And make sure you have your pen, your paper, because you're going to be learning new things. And I'm sure it will be beneficial to you in years to come. So please, I want you to share the live, and please tap on your screen. Tap on your screen. The more taps, the more opportunity you give others to come and learn. Your tapping is actually what brings people, not that they just discover and come. So you want to tap on your screen so that more people join us. Let's hit 10K likes first before we begin this two all important discussion tonight. And for those who have questions, as usual, we will answer your questions. More likely, we would have answered your question while we are having the discussion. So you need to be patient. Fertility issues requires patience. Those who are in a hurry will either find themselves being scammed, find themselves spending more money than simple instruction that money cannot buy. Right? So let's start on right by the time we're done. So what is morning sickness? What is morning sickness? It's actually a pregnancy-related nausea, sometimes with vomiting, that occurs mainly in the early pregnancy. It occurs mainly in the early pregnancy. 63 people in the FYP, I greet you. You want to jump in. Our flash goal is almost out. So please let us hit that flash goal. We still have four more first gifts to go. Right? So like I was saying, morning sickness is the pregnancy related nausea that is sometimes associated with vomiting that occurs mainly in the early pregnancy, right? It usually begins somewhere around, if you were here yesterday, so this is going to be an additional knowledge because what we are discussing is a continuation from yesterday's discourse. Okay, before I go into it, let me just shoot a flare. I'm sure it's going to help get some more people who may be looking for this information. So let's shoot a flare. So some people who need the information will see us and come, right? So like I was saying, this morning sickness usually begins around 5 to 6 weeks, right? It begins 5 to 6 weeks and peaks around 8 to 10 weeks. It peaks around that time. For some people, rather for most people, it gets better. There's improvement anywhere around 12 to 14 weeks of pregnancy. So for those whose case who feel this nauseousness, vomiting, and those kind of symptoms, by the time they hit 12, 14 weeks, they become better, and some of those signs and symptoms vanish. But some women will feel these morning sickness symptoms earlier, right? Earlier. Some will feel it later, and for some others, unfortunately, they'll feel it all through the days of pregnancy. I used to I used to live with my uncle rather years ago. Good evening. Good evening. Speak wow. I greet you. You're welcome. Good evening, Ezinwa Jeku. Hi, good to see you. Now, some people feel this morning sickness all through the pregnancy, right? Unfortunately, I live with my uncle, and anytime the my uncle's wife becomes pregnant, she will be sick all through the pregnancy, all through. So anytime I see her falling sick and she's not recovering, I know she's pregnant. So sick that she gets admitted in the hospital. And this is somebody who has, I think, the last count, she has 5 kids. So for all 5 children, she was sick throughout the pregnancy. Yeah. Who is that? Is that Ezin Wajeku? You did. Okay, okay. So how are you feeling now? Are you okay? Are you okay now? Let me know if you're feeling all right. Right? So that is what morning sickness is. Now, why does morning sickness happen? Why? Because it's not enough. The pain is too much, but I'm fine. All right, yeah. You'll be fine. Don't worry. You'll be fine. Mel B, thank you. Don't worry, you'll be fine. You'll be fine. And you'll carry the baby. You'll carry the pregnancy to term. Don't worry. Don't worry. We are with you in this journey. Is that okay? Thank you. Okay. So it's not enough to know that there's such thing called morning sickness. I just told you what it is. But it will be wrong of me not to tell you why morning sickness happen. And I'm sure a lot of people wants to know why morning sickness happen. If you're one of those people, please engage, communicate with me in the comment section. Tell me you want to know. You want to know why morning sickness happen? Just say why. I understand what you're saying. Why? Why does morning sickness happen? Right? Do I have somebody asking? Nobody's ready for that information yet. So, but it's important. It's important we know why morning sickness happen. We know the what. We know the what, but why does it happen? Why does morning sickness happen? Right? Morning sickness is not random. It's not random at all. Yeah. It is actually the result of a powerful biological change that is happening inside your body. And some of you who have been here for quite some time, if you have followed my journey to parenthood from the beginning, you can almost know why this happens. But for those who are just coming, it's important we lay it bare so that everybody gets the same quality of information, right? So, like I said, morning sickness is not random. It is actually the result of biological interplay, biological changes that happens inside your body, right? Now, the first reason why um, morning sickness happen is pregnancy hormone on the rise. So you want to start with number one. Okay, Miss Bree, I know you are very excited right now. When it's time to talk, If you are still here, we'll bring you up. You come and tell us the good news. I want to hear this kind of news. I want to hear this kind of news. We have actually declared that December will be an avalanche of positive pregnancy everywhere. All those who desire to have children, this month is your month. Especially those who have been listening to me. If you have done all the things I asked you to do, I guarantee you 99% you will be pregnant. And since December 1st, we've been getting people to say, hey, I'm pregnant, all over the place. So it's your turn. It's your turn. Your case is not hopeless. Your case is not hopeless. All right, so let's go back to morning sickness. If you are not tapping on your screen, you are wrong. This information is too important for somebody out there not to hear it. So tap on your screen. We have 13 people in the FYP joining us. So we need more taps to increase that number, right? So please, everybody engage, comment, tap on your screen, share the live, right? Just imagine if everybody knows what to do to solve their infertility challenge. The world will be a better place. Somebody said if they know everything, we will not make money as doctors. Well, I will just retire and go to farm. I will go and farm yams, right? So I'm not hopeless. That's why I can give you the information for free. The same thing you pay for in your consultations, right? All right. So we're talking about why does morning sickness. Who made that? Who mentioned that? I hope it's in a positive way. Little. I hope it's in a positive way. There is no hopelessness in this live stream, so I don't want any negative comments, right? So if you have a challenge, you want to talk to me, I will direct you on what to do. So no negativity, please. All right. So we're answering the question, why does morning sickness happen? And number one, we said pregnancy hormone is on the rise. The pregnancy hormone is HCG. There's a rapid rise of pregnancy hormone. And this is the main hormone that is responsible for pregnancy. This hormone confirms pregnancy. This same hormone supports progesterone, right? It supports progesterone. The same HCG supports or helps to maintain the placenta. You see why it's very important for it to rise. And it is the rise of the HCG, the pregnancy hormone, that is one of the reasons why the morning sickness happen. It also affects the stomach. This HCG affects the stomach, right? So this now begins to explain some things that you feel in your early pregnancy, but don't go anywhere. Just relax. I'm going to break it down so that you'll be left in no doubt, right? So this HCG, pregnancy hormone, affects the stomach. It irritates. Now there is a vomiting center in the brain, right? As the pregnancy hormone rises, it irritates that vomiting center in the brain and triggers it to cause you to vomit. That's why you feel nauseous, right? The higher the pregnancy hormone, the more nauseous you will be, right? So now you're beginning to know why you feel nauseous, right? So I said it affects the stomach. It irritates the vomiting center in the brain, right? And now this explains why in twin pregnancy, nausea is worse. Those people who are carrying twins, the nausea they feel is worse. Why? Double trouble for twins, right? So it's good to carry twins, but just know you're up for double trouble, right? The nausea is worse because you have more HCG in the early pregnancy stage, right? And for IVF pregnancies, it often have stronger symptoms for obvious reasons. Besides the the HCG that was given to you while they were preparing you uh, for follicular collection, egg collection. By the time they eat implants, the fetus, the embryo, will produce more HCG. So, so it also increases even more for people that carries IVF pregnancy. So you have a stronger symptoms. So don't worry about it. It's not a danger. I'm explaining to you why it happens. So that's the first reason why morning sickness happen. The first reason is the rapid rise of pregnancy hormone. Yeah, the rapid rise of pregnancy hormone. The second reason is progesterone. Progesterone does something. Who is ready? Who is here and is ready to hear about progesterone, the impact of progesterone? Who is ready? If you're ready, make comments in the comment section. Let me be sure you're ready. Who's ready? All right. All right. So progesterone. You know what progesterone does? It will shock you. It will shock you what progesterone does. If you're just joining, it's important you tap on your screen. All right. I keep on emphasizing on tapping on your screen because not for me. The more you tap, the more people get to see us and they're coming to learn. God has blessed you with the information for free. Give other people opportunity to learn the same thing for free. Because if you go before you're in your consultation, you pay for it, right? So let's be generous, as I am generous, right? Let's do. Thank you very much. So progesterone actually slows down digestion. Whoops. That almighty, wonderful progesterone that we talked about. How many of us remember what I said progesterone does? I mean, those who have been here anyway. So if you are coming for the first time today, you may not even know anything I'm talking about. So I'm talking about those who have been here. Can you remember what I said progesterone does? At least two things. It's more than two anyway, but at least two things. Can somebody remember? All right, I will not go back to it, but progesterone does something. But besides that, now that you are pregnant, progesterone slows digestion, right? Because, progesterone normally is one of those things that help to relax. 14 people in the FYP, I see you. You want to jump in and tap on your screen. Let us make the live stream worth it, right? Progesterone helps the uterus to relax because the uterus normally is a muscle. It has this rhythmic contraction that happens, whether you know it or not. You only begin to know about it when the contraction is heavy and you're feeling pain. Say, oh, I'm feeling low abdominal pain. It's all about the contraction that happens, right? So progesterone, when it's produced, it relaxes that contractions. And that's the normal thing. Make you no go squeeze the baby where you did. You are looking for pregnancy, your uterus is squeezing it out. Does that make any sense? Right. So that's one of the things. That's one of the things progesterone will do to relax the uterus so that everywhere go good. And besides relaxing the uterus, remember it also um it also reduces the effect of the immune system against the embryo, because the embryo does not recognize this. Sorry, the immune system does not recognize this embryo, so there's a tendency of attacking it. So progesterone is what actually goes there. Say, hey guys, not be everything that they attack. This one is good. Let's have the baby, right? so so progesterone is your best friend. In fact, another name for progesterone is pregnancy protector, right? I see your questions. Can you just exercise some patience? Tap on your screen. By the time we get to question and answer, I'll answer your question. Is that okay? I have your time. Don't worry. Nobody will miss out on anything. Is that okay? So for now, just tap on your screen and give other people the opportunity to join the live stream. Is that okay? All right. Thank you very much. So progesterone also prevents miscarriage for the reasons I just mentioned: immune system, contraction, and also progesterone is the reason why the embryo can dig into the uterine wall and implant itself. Progesterone is necessary for implantation because it enriches the uterine wall, make it robust enough like a flower bed for the seed to be planted. Is that Stephen? Stephen, very long time. Good to see you. You're welcome. You're welcome, Stephen. Anyway, but it also slows down this progesterone, all this wonderful thing I just mentioned that it does. Besides that, it also slows down the rate at which your stomach empties, right? It slows down the emptying rate of the stomach. It relaxes the gut muscle, and that comes with an implication. If progesterone is doing that to your stomach and your GIT, it comes with an implication, right? It causes you to feel this fullness. Those who have been pregnant, you can agree with me. There's this sense of fullness that you feel when you are pregnant. You feel also, besides fullness, you feel bloating or bloated, depending on the English you want to use, right? It also will cause nausea, right? Because nausea. For some people, acid reflux, right? You feel this burning sensation going back as if the food you've eaten is not going down, and some burning sensation. Even though some women over the years in my practice have listened to a lot of people and their experiences, some women have actually said that is not scientifically verified, but some women have actually said that when they have heartburns, I just told you the reason for heartburn, acid reflux, right? But some have said that when they have heartburns, there is the tendency that they have a baby that is going to have a hair, full hair. I've only confirmed it in one particular patient. I've not confirmed it for a number. So maybe when I get a funding for that kind of research, I'll go and do it and come and give it definitive. But some people have said so. I confirm in one, but I want to take them by their words. Again, we're talking about what progesterone would do, besides all the good things it does. In Yes, that's a local belief. Yes, that's a local belief. But local belief can be scientifically proven too, just for us to take our time, go and investigate it, right? But if I don't get funding, I'm not doing any research again. Me say make a rest. You don't do. No be to Maybe to they go to school until you die. Anyway, I said progesterone will cause you to feel fullness, bloating, nausea, and acid reflux. Acid reflux. And these things I'm mentioning have been the experience of many women, right? Yeah, in a way, I will not say that, Stephen, I will not say that definitively here, but when we enter a professional class or discussion, I will tell you, I will tell you the details of that. But now I'm speaking to general public, right? I'm speaking to general public, many of whom are not professionals. So I will leave that discussion till another time. But I can tell you, you may not necessarily see the quantity of hair, but you can tell. Anyway, um, where was I? So because of this effect of progesterone, good evening, Emanuela. Good to see you. You're welcome. So because of these uh, things that progesterone would cause, right? Your food will stay longer in your stomach, right? It will stay longer in your stomach, and of course, when food is staying longer in the stomach will protest, right? The stomach will definitely protest by the constipation feeling and all those feelings, right? So that is the number two reason for morning sickness. Let's go to the number three reason. All of them so far has been um, so where was I was actually talking about why does uh, morning sickness happen, and I mentioned um, pregnancy hormone as HCG, the rapid rise of it, right? Then I mentioned progesterone, right? So morning sickness, there are women who have a super nose effect when they are pregnant. What does that mean? Super nose effect. Is that not interesting? In other words, they have heightened sense of smell. Heightened sense of smell. Pregnancy sharpens their senses. So much so, their sense of smell is so sharp, right? Now, the smell that they usually would not perceive, or smell that really doesn't bother them before, may begin to bother them, may begin to cause them to gag. Have you not seen women, or maybe it's your case? You like, this smell is disturbing me because they are pregnant. It causes them to gag. Some others may cause them to vomit, right? For some others, dizziness. Dizziness. Why? Heightened sense of smell. I call it super nose effect. They can smell anything in Africa. And the common things that triggers, it's not the only thing, but the common things that triggers this super nose effect, right? Now, if you have your own experience, please put them in the comment section as I talk, so that it not look like a film trick. And also, it's important you put your experience, because I also want the husbands, the men in this live stream, to know, so that they will not be too harsh on their wives. They should be more caring and loving, right? So that's the reason why I need men to be here. So the common things that will trigger this super nose effect would include cooking oil. Cooking oil. The very cooking oil that you must use to cook for the family. Is that not interesting? Right. 14 people in the in the FYP. I see you. You want to jump in? And please, let's take the likes up. We're not yet at 10K like. Come on, man, guys. 46 people here, and we can't hit 10K likes. Come on now. I want to stop here for now. It's not right. It's not right. What your tap does, it gives other people the opportunity. Remember, nobody is paying for the knowledge. Just your tap will help somebody else. So please, let's tap on our screen. It's not right. It's not right. Right? It's not right. Then for those of you who are just coming, you want to drop a heart me if you actually appreciate the knowledge you are getting. Right? If you do, drop a heart me. Because that makes sense. Heart me is just one coin. We're not asking you to pay us for anything. Just show appreciation that hey, what you're doing is right, is good. Is that okay? Please let's take the likes up. Let's take the likes up. 13 people are looking at us from the FYP. We are discussing morning sickness. We're telling the whole story in details. And after morning sickness, we're going to talk about Azoospermia. All the details that you need to know. And the hope that you still have if Azoospermia is your case. So please invite the men. If you have to call them on the phone to join this live stream, get them to come. Get them to come. Everybody, especially if you are trying to conceive, you need to be in this live stream. Right? So let's keep taking the likes up. It's not for me, it's for others. Right? Thank you very much. Okay, so where was I? Where was I? Thank you for the likes. So I was talking about common triggers of this morning sickness. Common triggers. Super nose effect. Right? Just 1 minute, guys. Just 1 minute.
To my TikTok fam, from clinic to camera, you didn't make this journey sweet. Now you be the real MVP. Let's go. I did wear my scrubs till they chase my dreams. Drop one health tip, now then they scream. You too sabi, now waiting I hear. But now your repost make the people care. You did like, you did share, you did drop that wow. From 0 views to we trending now. Don't be small thing, you did ginger me. You tell my post to pharmacy. Love bless up my people. For the love, for the views, for the TikTok. If you feel the vibe, make you double tap. Come and give me that clap. Bless up my people. They boost my post, no stress up. If it's content, they sweet you well. Follow and repost, make the numbers swell. Sometimes I'm tired, but your words they lift. You they save lives, now better gift. From clinic gist to wellness chat, we they educate, no be just too young. So if my post help your papa or sis, or you learn small from my diagnosis, no they hide.
All right. So where was I? I was talking about super nose effect, right? Super nose effect. So I said the common triggers for these super nose effect. The common trigger is cooking oil, and somebody mentioned palm oil. Of course, it's included because it's one of the cooking oil. Perfumes. You know, there are people who, in fact, you have to clear the whole house of perfumes and air freshener. You have to clear it because when they are pregnant, they don't want to perceive that thing at all. Fuel, petrol. Petrol is another one. Thank you very much. Body odor. That is super nose effect. They can perceive body odor wherever it's hiding. Right? And certain foods. There are some people when they are pregnant, they will say, no, I don't want that. I don't want to perceive that yam. Take that yam. It's smelling. It's not really smelling. It's just that they are hypersensitive. Their smell sense is hypersensitive. Right? So if you have understood anything up to this point, please type in the comment section, understand. Who is asking about Coke? You are looking for trouble, right? Coke. Of all the things we said about Coke, you are coming back to us of Coke. Is Coke water? If you want to drink water, go and drink water. Eh? Please. Go and drink water. Alright, so up until this point, if you understand, engage in the comment section. When you type on the screen, I get to see you and see your name, and I remember. Alright, so that's the reason why it's important you engage. If you test positive, why are you still expecting period? Is that not confusion? Zendies. If you test positive to pregnancy, which is what we're looking for, so why are you still expecting menstruation? I don't understand. You're causing confusion. Anyway, it's important for me to help you understand still. Hey, Chrissy is here. Hello, Chrissy. How are you? Good to see you. Right? It's important for you to understand that this morning sickness is also serving a protective purpose, right? It has this evolutionary protection of your baby. It's one of those things that God put in place to help protect your baby, right? And from that survivor perspective, early pregnancy, we already know, for those who have been joining us, already know that stage, week 1 to week 12, is the most delicate stage. The most delicate stage. And anything can happen. And because it is delicate, the body must find a way to protect it. And one of those protection is morning sickness, right? And again, besides it being the most delicate stage or fragile stage of pregnancy, the baby is at this stage forming vital organs. Just like I told us yesterday and the day before, how that first the brain and the spinal cord is being formed. You remember when we're talking about the nutrient that is necessary for first trimester, and I told you why folic acid is important, right? So it's so delicate because this is when organs and major aspects of the body is being formed. So the body must find a way to protect it, right? So the things that happen in your body are not just random things. They are carefully dictated by biology and some supernatural force. 15 people in the FYP, I see you. You want to join us as soon as you can, right? So morning sickness, this is how morning sickness will help your early pregnancy, right? It prevents you from taking in toxic foods. You see that food? I say this food is smelling, this food is smelling. The one you used to enjoy before you became pregnant, now it's smelling. The body is suggesting to you that this contains something that I may not need. It does not happen with everybody equally, right? Because somebody may want to eat a lot of yams, some other person don't want it. But just the body's way of saying, no, don't eat this food. Don't eat this food because it can harm the baby. This can harm the baby. This can harm the baby. Then in another way, it craves other foods. So while it's rejecting some, it's craving for. So it's just the protective morning sickness. It's a protective thing. So do not say, "Oh God, women are trying. We are suffering too much." I know, you know, women can get so offended as men, and they say, "Oh God, why can't men get pregnant?" Because they are so offended. Sorry, men can't get pregnant. MSEG is here. Men can't get pregnant. Sorry, right? So you are already equipped with all the, well, with everything that you need. Good evening, MSEG. You're welcome. You have been equipped. So the morning sickness helps you to prevent intake of toxic food. That is one of the protective mechanisms of morning sickness. And it also helps you reduce exposure to harmful substances. That is why you begin to hate body odor, begin to hate perfumes or certain things that were sprayed in the environment, right? Hi, Bookie. Bookie is here. Hello, Bookie. Good to see you. Right? So this is why nausea is strongest during organ formation around 6 to 10 weeks because of that protection. The body will not allow you to just take anything. If you take any healthy when you get sense, you vomit it. Because at this time, your body have trust issues. Your body have trust issues. If there's something coming in, the body does not trust it, it causes you to vomit it. And it makes you to appall things that you normally would have around you. Perfumes, fuel, uh, um, some insecticides and stuff like that. Even food. That is for protection. So morning sickness serves a protective role. So it's not a bad thing. And please don't wish it on men. Men cannot carry it. If man suffer morning sickness, they may not survive up to 2 weeks. Yeah, I know. Some women will wish that men carry pregnancy so that they too will understand what we are going through. Right? Don't worry, Rahila, you will take it. Don't worry. Don't worry. Just make sure you are listening to me. You will take it. I guarantee you. So when it's time to ask questions, you want to come up and let me know the peculiarity of your case. Right? Okay. So these are the issues. So the question is, I haven't heard all this. The question now is morning sickness a good sign? Is it a good sign? Right? Is it a good sign? Well, from what we have said so far, in most cases, morning sickness is good. In most cases, morning sickness is good. Because studies have shown that women with morning sickness often have lower miscarriage risk. If you didn't hear it, go and carry cotton bud, clean your ear, and I'll say it again. Is that Ogochukwu? Ogochukwu is here. Good evening, Ogochukwu. Good to see you. You're welcome. So can I say it again? Studies have shown that women with morning sickness often have lower miscarriage risk. Why? Because morning sickness serves a protective function. It's a way of the body protecting your pregnancy from you losing your pregnancy. If you understand up to this point, can you just talk to me in the comment section? Say, I understand. Hello, all 45 people that are listening to me right now. I greet you. Good to see you. So if you have not followed me, follow me now. If you have not dropped a heart me, and I wonder, why have you not dropped a heart me? It's wrong. Drop a heart me. Encourage us. Hmm? Be a good student. Be a good student. Drop a heart me. Okay. So is morning sickness a must? No, it's not a must. Mommy ly is not a must, right? Every woman respond to um, pregnancy hormone differently, so it's not compulsory that they will respond to it the same way. But regardless, this protective function is still done whether you know it or not. Is that okay? Right. All right. So I know we are learning. I know we are learning. So I just told you that women with morning sickness often have lower miscarriage risk. Is that how they just feel? Tired, nauseous, vomiting, blah. You know, it's for protective function. It's not because God wants to punish you. You know, somebody can be so spiritual. So, oh, it's God that cursed women. A woman will suffer in pregnancy. Not lie. It's not true. It's not true. It's not true. It's not true. The only thing God said, because me, I'm a man of science, and I'm also a spiritual person. So I know what God said. God only said, in childbirth, you will feel pain. So it's not morning sickness. Morning sickness is an evolutionary um, uh, occurrence that protects your baby in the early stage. Is that okay? All right. Now we know. Also, it usually means that the hormones are rising appropriately. It means the hormones are rising appropriately, right? But lack of nausea does not mean something is wrong. Like she was asking. No, that you're not feeling nauseous does not mean that something is wrong with your pregnancy. It's not true. We all respond. No, women all. If I say we, I don't get pregnant. So women, all of them do not respond to pregnancy the same way. So not everybody must be nauseous. Not everybody must vomit. Not everybody must be sickly, right? So they all respond to pregnancy differently. Some healthy pregnancies have no sickness at all. Zero sickness. They don't even know anything is going on, right? So we're talking about morning sickness for those who are experiencing it. So if it's not your case, God bless you. Move on with your life. Is that okay? All right. So after we've said all these wonderful things, when now does morning sickness become a problem? I said morning sickness is good. It's protective. And I told you the reason why it happens. Right? So we've seen the how, we've seen the why. So let's talk about when morning sickness becomes a problem. Who is ready for this gist? If you're ready, as usual, talk to me in the comment section. Right? Talk to me in the comment section when morning sickness becomes a problem. All right. Okay, so if you are not following me yet, you better follow me. You better follow me. Because a time may come, I may just decide to have this discussion only with fan club members, or only with followers, or only with subscribers. But for now, there's too many people out there who needs information, right? Some may have money, some may not have. But let's give everybody equal opportunity. That's how the blessings of God is. Everybody have equal opportunity. So that's what we are doing tonight. So just tap on your screen and we are good. So when does morning sickness become a problem? When? The normal morning sickness would be anywhere from mild to you experience anything mild to moderate nausea, right? You are nauseous, yes, but it's just mild to moderate, right? With some occasional vomiting here and there, right? And you still, because it's normal, you still be able to eat something. Yeah, because you need food, right? You need food. You still be able to eat something, and also you'll be able to drink fluid. That is what a normal morning sickness feels like. Now, when morning sickness becomes severe morning sickness, this is not normal. It's not normal at all. The signs of this abnormal morning sickness include vomiting many times daily. Many times daily. That is not normal. Even though it's caused by the same pregnancy hormone. But that is not normal. You see, that's why I gave the example of how that I lived with my uncle, whose wife will always fall sick, so bad that she had to be admitted in the hospital, right? So that is not normal because there is threat to life in this case. So when you are vomiting too many times daily, that is not normal. Or you are unable to keep food or water. As in, the moment you take anything, it comes out. Anything you take, it comes out. Unable. Oh boy, I remember I used to work with a certain woman, my boss, years ago. Until today, it's only one child she has because pregnancy is a threat to her life. She took in and her life was never the same again. She was sick, admitted in the hospital for months. And trust, of course, we are looking for what the problem is. They test this, they test that. Besides being pregnant, everything is all right. But why are you so sick? She was sick for months, remained in the hospital for months. She lost weight, emaciated. In fact, at the beginning, they didn't know she was pregnant. It was after much check. Eventually, somebody did pregnancy test, and voila, she's pregnant. Lost weight, became a bony structure because she was pregnant. She literally lived in the hospital for most part of her pregnancy. She was feeding through tubes. Why? Because of this abnormal morning sickness. All right? Abnormal. You can't keep food down. Can't keep food down. When she was, even because it gets better anyway. So when she was beginning to recover after losing so much weight, she became a shadow of herself. My boss. So what's happened to you? Trust now. Spiritual people, we start praying. Oh God, we cast, we bind, we remove devil. We oh boy. Africans, we are wonderful. We love God. Because we are God's people anyway. Africans are God's people, direct descendants from God. So that's why we love God the way we do. So somebody will say, yeah, is it Africa? Yes. Yes. You can only be like your father. So even though people have bastardized this spirituality, but regardless, the reason why Africans spiritualize everything is because we are actually God's people. So don't abuse them for it. Just know who they are and where they are coming from. Is that okay? So I was saying, my boss became a shadow of herself. So when she was released from the hospital, she still could not eat. You know, when she was beginning to, she has to relearn how to eat. That it was that bad because her stomach was so, her stomach has been empty for months. She has to relearn how to eat. There are times I have to leave the office because she cannot eat unless somebody is there. In other words, she wants to see you to be encouraged to eat. Of course, her husband needs to go and make money. So those of us that are available will be the ones that go there. She so much has started with fluid. Then when she was trying to introduce solid food, she so much as pick the only thing she could take then was gari. If you don't know what gari is, I'm sorry. It's made of cassava. It's made of cassava. So she will pick granules of it. You know how tiny it is. Put in the mouth, melt it. So that she was relearning how to eat again. I'm talking about a 30 something years old woman at that time. She's in her 40s now. And it's because pregnancy became a threat to her life. That is why I think she does not have another child. She only has one. So that is an abnormal morning sickness. I said that story just to help you understand that morning sickness can be abnormal. And there are people who are at different level of the spectrum, right? Some are the extremes. So bad and so good. Are the extremes. Some people are just there. I've seen the extreme. I've actually seen the extremes. But most of the people are at the center. They are the rule, right? So on the signs of severe morning sickness, I was saying, is vomiting too many times a day, unable to keep food or water down in your belly, weight loss, you will lose weight. I think I see Chrissy telling us how she lost weight from 75 to 58. Weight loss. And of course, you cannot take water, your urine will be dark. Urine will be dark. Dizziness, weakness, these are the signs. This condition is called hyperemesis. Hyperemesis. Don't worry about the name. The full name is hyperemesis gravidarum. Don't worry, I don't want to bother you with big names. Just understand the concept. All right? When you find yourself or anybody that you know, men, if your wife is in this kind of condition, make sure you take her to the hospital. Don't do all this nonsense house care. Let the professionals take care of her. I've said more. So Let's look at what works for, or rather, what actually helps morning sickness, because it's very important. I remind you of your trouble, right? So let's look at what actually helps in with this morning sickness discussion, because it's important. It's not enough to just tell you what it is and what causes it. What can you do differently, right? That can help you, right? Mm. So, just to summarize the things you can do, you want to eat small frequently. Like my wonderful friend yesterday, she's pregnant and she's eating fufu. Some of us, we can eat. If you don't know what fufu is, I don't know how to explain it. It's made of cassava. So those of us in Africa will understand what fufu is. So some people can be pregnant and they just have like 8 wraps of fufu. Devour, 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 devour. Right? But if your morning sickness is not going to allow you, it is smart, right? To eat small every time. If in fact you want to do, eat small every 2 to 3 hours, right? Don't fill up your stomach because of the response to vomit, right? So you want to eat small, then another 2 hours, eat small again, eat small again. Don't wait until the hunger is extreme. Hey, Esther, good to see you. You're welcome. Don't wait until the hunger is extreme before you go and eat. Eat small. It will help this morning sickness situation you find yourself. Right. You also dry foods will help. Some people will look for plain biscuits. Some will look for crackers and all those. If that helps you, please go ahead. Right. And one of the most effective natural options that I've heard for some people is ginger. Why? Because ginger helps to calm the stomach muscles. It may not work for everybody, but for some people it does. And also it reduces nausea. Um, in Nigeria, I don't know about other African countries. In Nigeria, some women eat on uzu. Uzu is this earthy white substance, right? It does not taste like anything. They put it in their mouth, they eat it, their mouth becomes white. I don't know what they call it in English, but it looks like calcium stone to me. But they use that to help their nausea and vomiting and spitting. Sorry, all right. So I said that to say that you can take the options. You can take the options, whichever one works for you, right? And also avoid strong smell. You want to avoid strong smell so that it does not trigger uh, nausea and vomiting, right? You there is B6, vitamin B6 in your antenatal drugs. That helps also with the nausea. It helps reduce nausea and is safe for pregnancy. So your doctor will prescribe that for you. You see, in that your drugs you are taking. So you want to be smart when you're drinking fluid. Like we say with food, eat small every 2 hours. So with water, you want to sip on water slowly, not gush it down, and your stomach will react by by bringing it out, by vomiting it. Avoid large gulping of water because it's not going to help you. right? So, and you need to know that dehydration worsens nausea. So that's why you must take water, but don't gulp on it. Is that okay? You want to rest? You want to remove yourself from stress, reduce stress, right? Take a nap when it's possible. You know, I remember when I was in boarding school years ago. I will never forget. Now I just mentioned this thing about taking a nap. I just remember one lady insulted I and my friend, and I will never forget it in my life. We were coming back from school. Those days, the kind of school I went to, the class is a boarding school anyway. The boarding houses is far from the classes, so we have to walk like, if I'm not exaggerating, more than 1 kilometer to go to our boarding house. So after school, if you're hungry, you have to do that trekking to your boarding house. Right. So Esther said, Doctor, help. You relax. We are going to take questions and answers. So relax, calm down. Huh? So this particular day, we were so hungry, famished. And across Africa, the sun was high up there and hot. We were just walking, tired, finding our way back to the hostel. There's some ladies who were well taken care of by their parents. They have enough pocket money to eat at any time. While they were passing us, one of them turned around and said, "Why are the two of you walking like two pregnant cows?" Oh boy, I will never forget it in life. Well, yes, we were walking like pregnant cows because we were famished, we were hungry, right? so, so anyway, you are actually looking at one of those pregnant cows who is now talking to you how to handle your situation, right? So I said all that to say you want to take a nap whenever it is possible. Reduce all this workload that you have here and there. Reduce it, right? And again, emotional stress. Emotional stress. See, I've advised before, and I'm going to say it again. Couples, especially those that are trying to conceive, those who are in their early pregnancy or even pregnant at all, stop this acrimony. Stop the fighting. Stop the quarreling. It's not good. Emotional stress amplifies nausea. If you don't know, I'm telling you now. So when you are pregnant, it's not the time for quarreling. It's not the time for fighting. It's the time to work as a team because the baby needs you. Is that okay? All right, so let me advise you quickly the things you should avoid because I want to talk to guys now. We'll talk about azoospermia. But quickly, before we move to azoospermia, the things you should avoid when you are pregnant, especially your first trimester, early pregnancy, avoid self-medication. Don't do that. Self-medication, avoid it. Herbal mixtures that you are not even sure is safe, don't go there. Don't go there. Don't say, it is my mother-in-law that gave me. Is your mother-in-law an expert? She may be an expert in the Boca medicine. Right? She may be an expert where she's coming from. But don't take herbal mixtures. You don't know whether it's safe or not. Pregnant women, especially those of you in your first trimester, what are you fasting for? You're going for 1 week fast, 40 days fast, 100 days fast. Why? Because you are trying to move the hand of God towards you. Really? Really? Who told you that your fasting makes God do anything for you? Who told you? He doesn't. I'm a spiritual person, so I can tell you, right? It's just that that's not my niche. Your fasting does not do anything to God. It does something to you, right? And when you are pregnant, don't fast. You can fast after the baby has come. Of course, there are health benefits of fasting, not in pregnancy. Not in pregnancy. I know you want to be the most spiritual person. Don't do that, right? So this excessive fasting is not necessary. Okay? All right. Also avoid alcohol, avoid smoking, and all those strong stimulants. Avoid them, please. Avoid them. And make sure you take your antenatal care appointments very seriously. If you want to miss anything, don't miss your antenatal care. I know that they are going to teach you some things, they're going to check some things, and it's going to help you. So please don't don't um, don't waste your time sitting at home. Go and see your doctor. Let your doctor help you solve the problem, right? Esther, go and see your doctor. Esther, go and see your doctor. Esther, go and see your doctor. How many times did I say it? Go and see your doctor. I don't know this grammar you are speaking of. Go and see your doctor. All right, guys, women, please go back to your back seats. Guys, come forward. Let's talk. Let's talk about azoospermia. Let's talk about azoospermia. What is azoospermia? What is azoospermia? I'll answer after we finish with azoospermia. We will take questions, right? So exercise some patience, but make sure you are engaging by tapping on the screen, sharing the live, right? So it's important. We are still at 20k likes. No. We should hit 50k likes. We have 42 people in the viewers eye. If all 42 people tap on your screen, we will hit 100k in just 10 minutes. But not everybody is so generous to share the knowledge with others. That's why people are not tapping. We are not doing box game here. If it's box game, I know of tapping. You people are just ridiculous. Now, we are telling you your tap. We give somebody opportunity to come and learn and give them a better chance of success in their journey of parenthood. You said no, that's selfishness. Selfishness. It's not nice. Sometimes I wonder, why am I even worrying myself to give people things for free when there are no many nice people in the world? It's not nice. Anyway, so let's tap on our screen. That's the best thing you can do for the next person. And I'll keep on saying it. What you should never do, don't even wish infertility on your worst enemy. And most of the people suffering infertility today is lack of knowledge. It's not because something is really wrong. I can tell you. Just give me 2 people who have infertility challenge. 2 of them. Let me work on them between 3 to 6 months. We could see whether they know carry belly. Just by listening to what I tell you. Didn't you hear the other lady? Why she was already ready to go for. I was the one that actually directed her to the facility she was supposed to go for the IVF. She was ready on her, she was going there. Then she went to do an ultrasound. Voila, she was already pregnant. Somebody who has been looking for 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 2 years. What you need is knowledge. What you need is knowledge. It's not prayer. How do you even pray when you don't know what's wrong with you? What you need is knowledge. And I wish everybody have that knowledge. And the only thing you can do is to help us get other people to hear this. So don't be selfish with information, because the person giving you is not selfish, right? So let's talk to guys. Guys, come closer. Let's talk. We're talking about azoospermia, right? Azoospermia means zero sperm. as simple as that. Azoospermia means zero sperm, where no sperm is seen in an ejaculate. And just like I was explaining to Aristotle a few weeks ago, people think that because they ejaculate, therefore they should be able to impregnate a woman. It's not true. It's not true. When you ejaculate, what you see, what you see is semen. What you see is semen. Semen is like the packaging, the protector, the nourisher of sperm cells. So the sperm cell is within the semen, right? So you don't see sperm cells with your eyes, but you can see semen, because it's like the the package with which sperms are delivered. And it is possible that the sperm is not adequate. It is possible that there is no sperm in the package. Just like you may order something online. They sent you the package. You've received it. Then you open up the box. There is nothing inside. That's another way to explain azoospermia. Semen without sperm. So don't tell me that you ejaculate one bucket of semen, therefore you should impregnate all the women in the world. It's not so. It's not so. What brings about pregnancy is sperm meeting egg, not the quantity of semen you produce. Where is the semen content coming from? There are lots of glands, right? There are a lot of glands, like prostate gland. I don't want to mention them. I don't want to bother you with those, right? So azoospermia is when you have ejaculated and there is no sperm in the semen. That is azoospermia. I'm talking to men. So if your husband is by your side trying to sleep, carry the earpiece, put for an ear, make it hear. If your brother have a situation, call him, come and join this live stream. Is that Mira? Mira is here, right? But the reason why I'm talking about this specially, because I want to bring hope. Merry Christmas. Merry Christmas. Thank you. The reason why, when it's Christmas Day, let me be sure whether I'll be on live stream. I'm definitely going to be on live stream every day. But is it on a weekend or is it on a weekday? If it's a weekday, I will be on live stream. If it's weekend, I will not be here. On Thursday, oh really? Really? So let's see what the Christmas topic will be like. I know a lot of you will be all over the place enjoying yourself. It doesn't matter. For those that will be with me, will learn something. It's not- So the reason why I'm discussing azoospermia today, where am I from? What do you mean, where am I from? I mean, I'm a Nigerian and I live in Nigeria. Is that okay? So the reason why I'm talking about azoospermia tonight is because I want to bring you hope. Azoospermia is not the end of fertility. I want to bring you hope tonight. It's not the end. Don't now go and break your marriage or go and start blackmailing God. It's not the end of fertility. I told you, most of the infertility people suffer is because of lack of knowledge. And the street is not smiling. They will collect money from your hand like mad without telling you these details I'm telling you. I'm telling you the truth. You will pay through your nose and nobody will explain anything. In the end, you still bring that result and come and show me that is telling you for free. So tap on your screen. That is the payment that you are paying me now. All right. So I was saying, which network? Don't network here. Network should not do anything here now. So I say all this to say what to do when there is azoospermia depends on why it is happening. It's not enough to know the what. That's the beauty about this platform. Because I always bring you the why of a thing. If you know the why, your problem is solved. The how is very simple. Of course, the how, I will tell you to go and meet your doctor. I'm not saying all this because I want you to come to my location. Don't come to my location. Go and see your doctor. Go and see your doctor. But if you don't hear me, you will pay money through your nose and yet you will not get clarity. Do you think the street is smiling? Everybody is hustling, you know. Anyway, I said all that to say what you should do when there is azoospermia depends on why azoospermia is happening, right? So let's look at blow by blow on this issue of azoospermia. I said before, if you have a friend, a brother, husband, cousin, whatever, whoever or wherever they are, call them to join now. Okay, oh. The first thing we want to do is first to confirm whether there is azoospermia or not. Darling, hi, darling. Good to see you. You're welcome. Right? We want to confirm. Let's confirm. Is it true that this individual has Oluwatoyin? I said your name is always rings in my head as Oluwatosin. You know. So we want to confirm this azoospermia. Is it so? So we're going to do a second opinion to confirm it's actually azoospermia. Azoospermia must be properly diagnosed. We don't want to work with assumptions, right? We're going to repeat the semen analysis twice. We're going to make sure this person must have abstained 2 to 7 days. It's not the time they say, Oga, come bring a semen sample. Then days before you come to the clinic, you are there knocking, waiting no good. Bro, you are not serious. You've got to abstain 2 to 7 days. or or the number of time that your doctor gave you, right? Right. And of course, we expect that it's a professional that is handling the case. Sometimes azoospermia is actually uh, uh, cryptozoospermia, and that means very few sperm seen only after centrifuge, right? But don't worry about that. I'm just trying to put the information out there, right? Then, after we have confirmed azoospermia, the next thing to do is, are we at 50K likes yet? Oh, come on, man. The likes is not going up. Why? Please, all 45 people, tell me why. Let us do family meeting, I mean village meeting now. Why why don't we want to tap on our screen? Why? Let's talk. Let's talk. Why? Tell me why. We have preached tapping. We have conjured. We have begged you. We have, as good as the information is, and we did not say you should pay. Come on, man. Because of this, I'm going to switch to subscribers only. So there is only those who subscribe. Whether you tap, you don't tap, at least you are subscribed, and we will just talk to you. But when it's free, it's important that you give other people opportunity to have free knowledge too. Why are we so selfish with these things? Right? Okay. Maybe after this journey to parenthood, I will switch to subscribers only. So let me pin let me pin subscriber. Where is it? I can't find it though. Okay, let me pin so that when the time comes, it's those who have subscribed that we will be talking to. But we're going to finish all this because we are not. It's not encouraging when we are begging that we give people opportunity to come and solve their infertility problem, and you are not helping us to achieve it. So it's better people just come and pay and get the information. All right. Even the subscription outside the app, the green app subscription, which is just 5K, wherever you are in this world, it's just 5K. Not 5K dollars, oh. 5K in Nigerian money. As cheap as that is, so that you can have free consultation throughout the month, it's still a problem. And yet you have a problem that you need to solve. Is it God that is doing it? Is it devil? It's not devil. Is that Hondo? Hondo, I see you. So I'm actually talking, I'm stalling because I'm looking at the viewer's eye, it's crashing. So let the people who are not serious go. So that I'll be talking to only those who are serious. Because some people are just selfish when it comes to sharing knowledge. So I'm stalling so that when you tire, you go. Let me talk to those who are really ready to learn. So I've said so far. I want to know, the Uzi, Global Uzi, are you here? I saw something about you now. If you are here, good evening, good to see you. All right, all right. So where was I? I was saying that good evening, Aqua Mirror. Aqua Mirror. I saw one of your videos. Wonderful. Good to see you. I can't remember where I was because I got distracted with people not tapping and all that. So it's a lot of it's a distraction. I want you to just face on telling you what you need to do instead of worrying about tapping. Tapping should just be something that is default. No, you cannot ask question. No, no, you cannot ask question. In fact, anybody who did not tap more than 1K will not ask question. You are not following me. You have not tapped. No, you hurt me. Come on, man. Why? That's frustrating. And you are not even doing it for me. You are doing it so that other people can see the live stream and come and learn. I'm going to convert this thing to subscribers only because it's not encouraged. People are not helping. You don't want to help other people. Why? Why is it so? There's I can't remember who sang that song. Um, it's an old school song. He said there is not much justice in this world, and this is one of the things. But if I'm here now, twerking, remove my shirt and start twerking, you see people from everywhere tapping, dropping gifts and all that because I'm twerking one rubbish twerking, right? So I'm still talking to the, I'm still talking to, we are trying to listen. Ah, no, that is not an excuse. That is not that's not an excuse. As you are writing with one hand, put the other hand to be tapping because your tap is what will give another person on this app the opportunity to come and learn. It's for them, not for me. I have the option to come on live and not to come on live, right? I have the I have the option. I can choose not to come, and one of my hair will not fall off. But I'm coming because people need. How many people is giving details like this? And yet, people are many who are trying to conceive. Just imagine a world where infertility is a problem. On top the infertility, there's a relationship problem. On top of that, there's bad eating habits, right? But when we try to help, we only beg you to help us help people, right? I'm not asking you to give me lion. I don't even know what that sounds like on my live stream anyway. so I'm not asking you to give me lions. I'm asking you to tap on your screen so that somebody else will receive a miracle. That's all. Okay, so I've been so distracted. I don't like to be distracted. I hate to be distracted because when I'm distracted like this, my morale will just go down and I will not deliver on the gist. This number has refused to go down. I was expecting that this viewer's eye would have dropped to 20 something by now. It's not dropping because people have started tapping. So as the unserious people go, the tap is bringing more people to join. So that's basically what's happening. Anyway, I was talking about azoospermia, and I said um, it is the absence of sperm cell in the semen, the ejaculate. So it's possible to ejaculate and you don't have sperm cells in that ejaculate. That's what I was talking about. So the next thing we want to talk about, let us classify this azoospermia. And I mentioned earlier the reason why I'm talking about this azoospermia because I want to bring you hope. You know, people say you have azoospermia. Oh, I'm done for. No more hope. you're frustrated, you stop trying. No, don't pack your bags yet. Before you pack your bags, listen to me first. And I guarantee you that no hope is lost. All right. Let's classify this azoospermia, right? Um, when azoospermia is diagnosed or confirmed, the next important thing that must be done is to classify it. And this is the most important step, right? This is the most important step. We will need to classify whether it is an obstructive azoospermia or non-obstructive azoospermia. This is the two classes: obstructive or non-obstructive. Let's start with the obstructive azoospermia. Yeah, let's start with obstructive azoospermia. Basically, the obstructive azoospermia means that sperm is produced, but it is blocked. Thank you, Mr. Tabs is here. Sperm is produced, but it is blocked from coming out. That is obstructive azoospermia. Is that clear? So what causes obstructive azoospermia? What causes sperm being produced and it being blocked from coming out? Guys, I know because we have ego, we really don't talk about it. But I'm helping us to talk about it now. Right? Sometimes some of our spouse don't even know that is what we are going through. But we say, no, nothing is wrong, something is wrong. And I'm telling you today. So what causes obstructive azoospermia? First and foremost, you see infection, previous infection, STI, sexually transmitted infection. You know, men are wonderful. Men can live, walk around, do whatever they are doing with infection. Some of them don't even know it's there. Some will be managing it until it brings them down. They will not go and take action. That's why I tell people, I love women. Just scratch a woman like this. She will shout so high heavens as if heaven want to come down. And yet it's just one small thing. That behavior is actually a protective behavior for women. That's why they live long. Small thing, they don't shout. They live longer. Then we are here doing Igbo people call it odeshi. Right? There was an experiment that was done years ago. Where they didn't say it was an experiment, but trust, when they bring out that kind of thing, just know say they did the experiment, right? It was according to them, it was an hypothetical experiment. I don't trust them. Anyway, they put a man and a woman inside the box in a very unpleasant situation. And every morning they will come and beat on them. By the time they are beating the woman will shout, yeah, yeah, yeah. Everybody home and abroad will hear that this woman is being beaten. She will shout to the highest heavens, God, come and help me. But when they are beating the man, you will not hear anything. You just hear things like, As they continue that painful torture, after a while, the man passed away while the woman is still shouting and she's still alive. Can you see the difference between these two gender? That's why when I tell you I don't trust the shouting of women, people think I don't like women. That's why they live long. So even when they feel small itch, they rush to the hospital. Doctor, I'm feeling itches. Doctor, I'm feeling pain. It's here. It's there. It's here. And they will be treated. Why the man is going 3 months with infection without seeing the doctor? 3 months. So I'm talking about the cause of obstructive azoospermia. And I said previous infection, sexually transmitted infections, and of course epididymitis, right? That's the first one. There's also the congenital absence of vas deferens. Vas deferens is the tube that connects the testes to the outside. Thank you for the treasure box. Thank you. So if you claim a point on this treasure box, you want to send a heart me. At least you don't have to spend your own money, right? All right. So some people are born without that connection of the vas deferens. Vas deferens is the tube that connects the testes, the epididymis, to the urethra, right? So when there is a congenital defect, absence of it, that is one of the reasons for obstructive azoospermia. Another reason is previous or prior hernia. Thank you very much, Mr. Taps. Prior hernia or scrotal surgery. Some must have done surgery, one thing led to the other. It led to the blocking of or obstruction of the connection between um, the testes and the urethra, right? Then there is also the obstruction of the ejaculatory duct, right? So these are the causes. These are the causes of obstructive azoospermia. Remember, in this case, sperm is being formed, but it is obstructed from flowing out in this case. So now let's now look at the the other one, non-obstructive azoospermia. Non-obstructive azoospermia. In this case, it's actually a problem of sperm production. Not that the sperm was produced but it's not coming. No. There's a problem with sperm production. Have this at the back of your mind so that when we start talking about the solution, it becomes clearer to you. That's why I told you, if you have azoospermia, hope is not lost yet. Before you pack your bags, wait and listen to me first, because this may just be the answer to your infertility problems. All right? So non-obstructive azoospermia is actually a problem with the sperm production, right? And the common causes of this non-obstructive azoospermia is actually a genetic. The first one is genetic disorder, right? Genetic disorder. One of the examples is the Y chromosome microdeletion, right? Genetically, you just cannot produce sperm. There are people like that. That's why I said, if you have been tested to have azoospermia, the next step is to go and do confirmation. If you follow what I'm telling you, it is difficult to stay in infertility. It's difficult. Anyway, it's a choice. So genetic disorder is one of the common cause. The other cause is hormonal failure. The same way women can have hormonal issues is the same way men can have hormonal issues. So it's not just only women. It's not only women that have hormonal issues. Men can have. So hormonal failure in men can lead to non-obstructive azoospermia. All right. There are those who went through or who are going through chemotherapy or radiotherapy that actually destroys sperm cell and sperm production. That is why if you are going for chemotherapy, it's advisable to freeze your sperm. It's advisable. Thank you, Mr. Tabs. Right. If you're going for chemotherapy and maybe you don't have kids yet and you wish to have kids in the future, please freeze your sperm. Is that okay? That is $1,000 information I just gave you. Right? Where you want to hear them? Where you want to hear them from? You cannot hear it anywhere. Freeze your sperm. Right? So, what's the next one? The next one is varicocele, severe varicocele. What does that mean? Varicocele means, now there are blood supply to the testes. Blood vessels carry blood to the testes. And the blood also comes with its temperature. I hope you know that the reason why testis is outside the body is because sperm production needs lower temperature for production to happen. I hope you know. If you don't know, you know now. Thank you, Mr. T. Thank you for clearing my life goal. Thank you. I appreciate it. Thank you very much. Thank you very much. I appreciate you. Right. Now, severe testicular damage also is another reason for non-obstructive azoospermia. And basically, in these cases, you have small testes or even soft testes, right? FSH will look high, will be high, and testosterone is sometimes low. So these things are the causes of non-obstructive azoospermia. Your doctor will request you to do these in case of azoospermia. Your doctor will request you. Men, I hope you are learning now. Because if you come to my DM, you must subscribe before I answer you. Subscribe as in TikTok or outside TikTok. You will. Because I'm giving you this information now. The doctor may ask you to do hormonal profile tests. Yes, men also do hormonal profile tests like FSH, LH, total testosterone, prolactin, Sometimes they may choose to actually do estradiol for men, right? They may also want to ask you to do genetic testing, which is very important. Why? Because it gives a lot of information on what is going on with your sperm, right? So genetic testing like karyotyping, the tests for Y chromosome micro deletion. There's such test, right? And if there is if there is a vast difference absence, there's a test that is called CFTR, right? CFTR mutation. There's such test. So some things will be done for you. Some things will be done. Even ultrasound will be done. Ultrasound will be done, and that will lead your doctor to help in managing your situation. Now, what to do in case of let's start with obstructive, right? In case of obstructive azoospermia, the first thing is to have a good prognosis and the options that is available. You could have microsurgical sperm retrieval, right? Why? Because in obstructive azoospermia, sperm is produced, but it's not flowing out, it's not coming out. So what they can do is to go to the point of where it is stored and get it out. Dr. Parts is here, right? They can access where it's stored, get it out, use it for IVF or ICSI, and you can have your baby. So there's no hope lost. No hope lost, right? So no hope lost. Pregnancy rates are even usually higher in this case, right? Now that's for obstructive. For non-obstructive, this is more challenging, but it is not hopeless. Guys, I told you, if you will just give me your ears, azoospermia is not a sentence to not having kids. No, there is hope, right? There's hope. Good evening, Dr. Pat. Right? For the even though the non-obstructive azoospermia is challenging, even though it is, what can be done is to you have to treat to reverse the course of the non-obstructive azoospermia. There's a reason why your sperm is not being produced. So locate it and try to reverse it. And these are the few things that can be done. Stop alcohol. Hold your ears like this. I will stop alcohol. I'm talking to men, so women are in the back seats. So men, come forward. Stop alcohol, smoking, using these anabolic steroids. Stop it. You wonder why you have this issue. Stop it. I'm telling you now. If there is infection, yes, yes. Mr. Tabs is responding accordingly. All right. Treat infection. Because if there is a cause for a thing, locate the cause and handle the cause. Treat infection. And if there is the issue, if it is the issue of varicocele, because varicocele leads to increased temperature there, right? It can be corrected. Varicocele can be corrected. So see your doctor, they're going to help you. Now, what about hormonal issues? You can have hormonal therapy, right? And your doctor know what to do. I'm not going to mention it so that somebody will not just sit at home and say he wants to treat himself. right? You can have hormonal therapy. And you can also even have, I've talked about that before, uh, surgical sperm retrieval. You just go where the sperm is produced, retrieve it from there, and use it for IVF. So that is not much of a problem. IVF or ICSI, and you have your baby, you will be happy, your spouse is happy, and the society is better for it. But there are cases where sperm may never be found, or may not be found. Let me use that, or cannot be found. If that is your case, which is not usually everybody's case, but if your case that you've done everything I've said and sperm still cannot be found, go straight for donor sperm. Go straight for donor sperm. If you think donor sperm is a problem, or you still want to have kids running all over the place in your compound, consider adoption. Right? Otherwise, you want to stay without children. You will never know the importance of having kids.
Low battery, please charge.
You will never know the importance of having kids until you're old. You'll never know. Our parents that used to have 10, 15 children, they know why they were having those kids. And they never suffered neglect. Why? Because there was always somebody available. But today, some people say they hate kids. Really? All right. See you at old age. Then we'll know whether you like it or not. So now is the time to start having children. If you desire to start a family, now is the time. Don't wait, right? So stop smoking. Watch your weight. Watch your weight. Make sure your food or whatever intake, your nutrients are rich in antioxidants.
Low battery, please
right?
charge.
Vitamin C, E, zinc, selenium, coenzyme Q10. These are all necessary nutrients for sperm production, right? Very necessary. And avoid heat exposure to your scrotum. See, when they tell men these things, they need a agree here. See the scrotum? The scrotum does not like heat. Stop wearing tight pants or underwears. Stop putting your laptop on your laps. Your phone that likes to be in that pocket, change the position. Hold it in your hand at best. Right? Sitting inside bathtub, hot one, because you have enough of money to buy jacuzzi. It's not for
Low
you.
battery, please charge.
Allow your... Sorry, that is becoming a distraction.
Love, now so we go fly high above. If you dey feel say yeah. If you dey learn say more. If you want support, repost drop a like or follow. Now so it go jam. Bless up my people. For the love, for the views, for the TikTok. If you feel the vibe, make you double tap. Comment, give me that clap. Boom, bless up.
All right, I'm back. So I was saying that as much as you want to use bathtubs, I would advise you, don't sit in warm bath. Don't do it, because your scrotum does not want heat, especially for those that are trying to conceive. Change your underwears. Stop using laptop on your laps. Stop sitting for too long. Right? Stop sitting for too long, and don't use hot baths. At least it will help the temperature around that place. and you are better for it. All right, so it's time for questions. I'm